Good morning, everyone. We have 12 new cases overnight. 6 are linked to current exposure sites or are linked to identified close contacts. 4 remain under investigation, and there are 2 cases that have no known links at this stage, although we continue to investigate those 2 cases. Of the 12, 2 were in quarantine during their entire infectious period. Sadly, at least 6 were infectious in the community and 4 are still under investigation. We now have 12 people hospitalised with COVID-19 and 3 in intensive care. Testing numbers were 2,262 yesterday. This number does need to lift, so please keep checking exposure site updates and come forward for testing. And as always, get tested as soon as possible if you have any COVID-19 symptoms. ACT Policing and Access Canberra were busy yesterday with a number of compliance activities. There were 284 traffic stops and 5 directions to leave the ACT issued by ACT Policing. And between Access Canberra and ACT Police, 133 business compliance checks were undertaken. And the feedback from both ACT Police and Access Canberra is that overall there were very good compliance with the public health directions from the businesses who were inspected. So I thank those businesses for taking the COVID risk seriously and for putting in place COVID-safe measures and in support of the public health directions being able to undertake their activities safely. This is really, really important to ensure that we can continue to keep businesses operating in the current lockdown environment. On vaccinations, we will start booking 16 to 29-year-olds for a Pfizer vaccination in the coming days. Over 25,000 Canberrans in this age bracket have already registered on the My Digital Health Record system. But if you haven't registered yet, please do so, and do so today if possible, to make the process as easy as possible for you once we are able to open bookings in the coming days. Now, being a Monday, it's appropriate to talk about the priorities for the week ahead. Dr. Coleman will be providing detailed advice to Cabinet later this afternoon on the management of the outbreak to date, what the data is showing us about the coming week, and what decisions will be necessary around the lockdown arrangements beyond the current scheduled date. The Delta strain is very, very challenging to contain. And as today's data confirms, we still have people who are infectious in the community. We still have cases that don't have a clear epidemiological link. This is concerning. It is very clear, as I've been saying for some time now, that we will require ongoing public health measures in place beyond this week. We do not want all of the hard work over the last few weeks to go to waste by opening up too early. We have 12 cases today. 12 is significantly better than 1,200. Our lockdown measures are effective in reducing the spread of the virus, but it is concerning that we are still getting cases infectious in the community and without those clear links to existing outbreaks or exposure sites. This means the coming months, the spring, will be difficult. We've got a really challenging balancing act between now and when we get to the point that our community is fully vaccinated. The journey from here will require careful and modest steps forward until we have more people vaccinated. So the objective of all of our decisions and all of our public health measures and everything we do over the coming months is to maximise the number of people vaccinated and minimise the spread of the virus and minimise the number of people developing severe illness. A simple objective: maximise vaccination and minimise spread and illness in the community. So in summary, for those who've joined late, 12 new cases, 6 of them linked, 4 under investigation, and 2 with no obvious links at this stage, although investigation continues. 12 people now hospitalised and 3 in intensive care. And again, I thank the wonderful staff in our intensive care unit for the care and support that they are providing those 3 individuals. I'll now invite Dr. Coleman to provide some further information on the new cases and epidemiology, and then myself, Dr. Coleman and the Minister for Health, Rachel Stephen-Smith, will be available to take questions. Thank you.
Thank you very much, Chief Minister, and good morning everyone again. I'm Kerryn Coleman and I'm the ACT Chief Health Officer, and as the Chief has said, since our update yesterday, we have recorded 12 new COVID-19 cases, bringing our total cases for this outbreak to 261. If you are thinking there is one missing, you might be right. This is due to a reclassification following additional testing. We do include these on notification, but sometimes further testing tells us they might be old cases or just a wrong result. The good news, though, is that a total of 25 of our cases now have fully recovered, so an additional 5 from yesterday, which leaves us with 236 current active cases. And as the Chief has gone through, of the new cases today, I can confirm that out of the 12, 6 can be linked to known cases or ongoing clusters. All 6 of these are actually household contacts and known to us. Unfortunately, the remaining 6 are not known to us at this stage and are still in the early phase of investigation. Secondly, out of the 12, only 2 were in quarantine during their whole infectious period and therefore posing no risk to the community. Of the 10 remaining, we know that 6 of these were infectious in the community for at least part of their infectious period, and 4 remain under early investigation. And as of this morning, sadly, we have 12 people in our hospitals, with 3 of these in intensive care unit, with 1 being ventilated. 11 of these are unvaccinated, with 1 person having received 1 dose. Since our last update, we have just over 600 self-identified close contacts and over 3,200 casual contacts. We now have 191 current exposure locations dispersed across Canberra. So again, no matter which region you live in, it's very important to keep up to date with these exposure locations on our website. You will sometimes see exposure locations with dates and times that are more than 14 days ago, and I know there has been some questions over the last few days about some that have popped up on our website. These are added as locations become known as a precaution. But if you have been to one of these locations at the time and date specified, we do ask you that you get tested and quarantine until you received a negative result. This is part of our process to make sure that we are identifying any potential undiagnosed cases in the community, and just helps us with a little bit more information. So to provide a broader update on the cluster at this time, there's been a very small change to our age distribution of cases, but generally they're still remaining much the same. 34% are aged 0 to 17 years, 50% are 18 to 44 years, 13% 45 to 64 years, 3% are aged over 65 years. We also continue to have 11 public sites of transmission, and we are seeing transmission again through household and close contacts. But overnight, 2 previously confirmed cases have now been linked to the Bright Bees cluster, which brings the total for that cluster to 28. Also, the total clusters for Fiction Nightclub have risen from 44 to 50. This includes 2 new cases and 4 previous cases, which are now able to be linked to this cluster. We now have a total of 4 cases linked to the Murchie Indian restaurant after a previously linked case was reclassified. But, as we've talked about before, we expect the total numbers for each of our public sites of transmission to continue to move up and down. Links to certain clusters and contacts may initially be identified through our early case interviews and self-reporting of site visits, but then they are sometimes reclassified as we get more information and more analysis occurs, and sometimes stronger links are identified. So today, my shout out goes to all of our couriers who are supporting our private and public pathology providers. I know you guys are working around the clock, transporting thousands of samples every day between the lab collection centre and the pathology centre where the tests are conducted. So this is really important, and this is how you guys are getting your results through your SMS testing. So thank you very much. I'll hand back to Chief Minister to start with questions. Thank you.
Thank you, Dr. Coleman. We'll start with questions on this side of the room.
So you're getting a briefing, the Cabinet's getting a briefing from Dr. Coleman this afternoon. So can you just clarify whether you will announce any extension to a lockdown tomorrow? And you did mention ongoing public health measures in place. So given we haven't met those thresholds in terms of having 0 cases infectious in the community, is the lockdown extension possible?
Well, we'll have that meeting this afternoon. It will probably go well into the evening, and so I would not anticipate making any announcements today. No, as in today, no, we won't make any announcements today. Would we hope to be able to make an announcement tomorrow? Yes.
If you continue to see cases which are infectious while in the community, would tougher restrictions be still considered?
Well, again, please allow us the opportunity to have the discussion with Dr. Coleman, looking at our local epidemiology and then continuing to learn from what we're seeing transpire in other cities. I've touched on this many times, but what we are seeing is a lot of household transmission. So once someone brings it into the house, pretty well everyone else in the household gets it if they're not vaccinated. The other clear areas of transmission have been workplaces and sites where a lot of people come and go. So I think we get a pretty good understanding of what our risk points are. And then there's, as I think we've discussed on a number of occasions in the press conferences, this issue of total cumulative risk that is just based on the sheer volume of people moving and interacting with each other. And so the balancing act that we'll be needing to strike, not just in this coming week, but beyond, until we get the vaccination rates up even higher, is how we minimise the transmission potential. And so you've got to look at the public health measures that would be needed in those really high-risk settings. So another question. This side, yes?
Are you concerned that another social housing complex is now an exposure site?
Yes, that's an area of considerable concern for us. What's happening across the epidemiology of the outbreak here, and what we're seeing in other cities as well, is that if the virus gets into high risk and vulnerable settings, it can really be a big setback for the overall pandemic management and the overall management of an outbreak. So in short, yes, it is concerning. That's why we are applying considerable resources in partnership with the community sector to provide support for those residents, but then also around the outbreak management that we need to undertake. So that means on-site testing, and it also means vaccination programs. Now, fortunately, in the cases that we've been talking about, there were already in-house or delivered vaccination programs, but they were first dose only. High levels of first dose only, but it's still going to be a challenge for us. This is the situation we face between now and summer, where our fully vaccinated population is still not at a level that would be sufficient to allow an easing of the public health protections that are in place.
Chief Minister, today Treasurer Josh Frydenberg issued another warning for states and territories who lock down their region after we've met those 70 to 80% thresholds. Do you think that that's a fair comment for him to make? And are you concerned that if the ACT does lock down after we've met those thresholds, that the government will turn off the funding tap?
Okay, well let's unpack each element of that. Look, the Commonwealth Treasurer can speak for himself, and will make all of the sort of muscular assertions around what the Commonwealth will or won't do, and that's perfectly within his right to do so. The lived experience has been somewhat different. The national plan does not prohibit lockdowns beyond 80%. In the local context, based on our vaccination rate and the rate of the national program, the ACT will be one of the first jurisdictions to go past 70 and then 80. The national plan has an inbuilt protection that it requires both the nation and the jurisdiction to both be beyond those thresholds before you would step to the next stage of the national plan. Now, the discussion at National Cabinet on Friday afternoon focused very much on the significant risks associated with the 70% threshold. So even the Prime Minister is now changing his language and his tone that 70% is not the magic number. It's a very gentle step forward, and the plan is very clear on that. There's all this commentary from people who have obviously not read the national plan that is incredibly unhelpful in the national debate. So to be clear on the ACT's position, we will reach 70 and 80 ahead of the rest of the nation based on our current vaccine rollout trajectory. And I would hope by the time the nation reaches 80%, which is a much safer level in which to be able to ease off some of the public health restrictions, noting that test, trace, isolate and quarantine will not be optimal when you have thousands of new cases every day, that 80 is a better number to be focused on when there's this glossing over in the debate, 70 to 80. Well, let's stop talking about 70 because it's not safe at 70, but 80 is the more realistic step. So 70 will be a gentle step forward, 80 would be a more significant one, and my hope is that by the time the nation reaches 80%, the ACT will be 90, or hopefully even 95. And once you've got that level of vaccination coverage, then you get as pretty close to herd immunity as you're ever going to get, to use the epidemiological term, and that makes things a lot safer. And so that is why our focus is on vaccinating as many people as possible, as quickly as possible, to get to the nation's highest level of vaccination, because that offers the greatest protection to our community.
The Housing Industry Association has issued a statement this morning criticising your assertion that residential construction is less safe than, larger commercial construction. They've pointed to your ACT government guidelines for the reopening of sites, which says large and complex building and construction sites present a greater risk of coronavirus transmission in the event of a confirmed case on site. So can you just explain again why, if that's in the guidelines?
Yeah, I did that at great length with Jasper yesterday, going through in quite some detail, but there's a cumulative risk in terms of the number of workers who are back at work. So I think the MBA have estimated that the larger sites get about a third of the workforce back. The next step in the construction return would see the rest of the workforce come back, but not whilst we are still in lockdown. So it might be a matter of weeks between part of the construction industry coming back and the totality of the construction industry coming back. But another factor, and I alluded to this yesterday, and people know this as fact, that even at the beginning of our lockdown, the areas of compliance fail were the smaller end of the construction industry. We had to have police out on site shutting sites down because people were willfully ignoring the public health directions. And across the construction industry, compliance ranges from excellent builders and constructors who take their responsibilities as employers to their own staff with a level of seriousness that I commend wholeheartedly. And then at the other end of the spectrum, there are people who operate in building and construction who think that the rule of law is optional. And that's what we're grappling with. And with a Delta outbreak, you are only as strong as your weakest link. And so that is why we are being cautious here. We will return all construction activity when it is safe to do so. But we're starting with the area that we believe will have the greatest level of compliance and the most effective way to manage. But that doesn't mean we won't restart construction. We will, we want to, but only when it's safe.
Chief Minister, we already know that regional New South Wales lockdown has been extended. For some of those border communities, there's still some confusion that we're hearing about for coming into the ACT. Firstly, have you had any discussions with the New South Wales Government to clarify and ensure that they are mirroring our requirements between the two borders?
We're doing our very best. New South Wales have indicated that they will advise us in advance of changes to their settings. I directly asked the Premier that question in National Cabinet last Friday and was given an undertaking that they would. We have agreed that as much consistency between the ACT and the Canberra region that's in New South Wales as possible is highly desirable. We're also looking at, I've raised the question of, can regional New South Wales have differential settings depending on where in regional New South Wales we're talking about? And I understand that from a New South Wales government perspective, it is a lot easier to have a Greater Sydney arrangement and then a rest of regional New South Wales arrangement. I appreciate that. But what we are exploring is whether there can be settings for the broader Canberra region. Of course, that then raises the issue of how far from the ACT is captured in the broader Canberra region. None of this is easy. You inevitably end up drawing lines somewhere, and there will always be some people who fall on the other side of whatever line is drawn. A factor for us in determining where lines would be drawn is the agreement and cooperation of the New South Wales Government, and then also what's going on in terms of the virus in those regions. So, for example, we had sewage detection in Cooma over the weekend. Not enough people came forward for testing, I'm advised, so it's still an area of potential concern. We've got the infamous Merimbula incident. So these are ongoing issues that present great challenges. And ultimately, we've got to make a decision that's in the best interests of the ACT, taking into account all of those really important regional considerations, noting that whatever you do, someone or some part of regional New South Wales falls on the other side of a line.
On that then, while those discussions are ongoing, can you give some clarity to the people from those border communities? What are reasonable or essential purposes for coming to the ACT at this purpose?
I'm not going to go through the full list here, but the information is available on the ACT government's COVID-19 website around standing exemptions. What are those reasons? And I think it's best that people consult there. That's where there's a lot of information. We endeavour to update frequently asked questions there, so that it would appear probably 95 out of 100 issues, the answer to which lies on the COVID-19 website. Just please go there and have a look. But as is the case, and every set of rules and boundaries and whatever you have, there will always be some unique circumstances that require a specific answer. We understand that, and that's why we have the phone lines and information lines to provide people with the opportunity to ask those questions. But the feedback from our call takers is that about 9 out of 10 issues that are raised, there is a straightforward answer on the COVID-19 website. So we do ask people to look there in the first instance.
Just wanted to clarify, Chief, are you aware of any of the new 12 cases being connected to that new exposure site at Argyle housing site or Condamine Court?
Look, I'll get the Chief Health Officer to address that. There may well be, and obviously there's a number, at least half, still under investigation, so there may well be a link, but we're not going to know that necessarily immediately. That's why we have to undertake the further investigative work.
Last week, the Prime Minister announced that 16 to 39s would be eligible for the Pfizer jab today or by the end of August. Now, I've spoken to a few people within the ACT who called up ACT Health this morning wanting to book appointments. They were obviously told no, that they can't. But you've just announced that it'll be within the next couple of days that those 18 or 16 to 29s become eligible.
Yep.
Why is there that couple of days difference?
Right.
Which is creating so much confusion for a lot of people.
Sure. You may have misunderstood, or the Prime Minister wasn't clear in his announcement when he said that it would be around registration and being able to make bookings, not to be able to access vaccination. The bookings that are being made for late October and November in large part. So the Prime Minister made an off-the-cuff announcement in a press conference without telling anyone. That's why there's confusion. Let's be brutally frank about that. He's entitled to do that. That's what Prime Ministers can do. It's not necessarily always helpful in terms of clear communication, but that's what happened. Many states and territories were well advanced in their planning to have a much more ordered and agreed process around accessing vaccination. So to someone who is 16 to 29 today who has not yet registered in the My Digital Health record system, please do so today, because when we do open bookings, you'll then be able to make a simple and straightforward booking online if you're in the system. And so that's my advice to people. Do that today. Now, 25,000 have already done that. And around 20 to 25,000 of that age cohort had already been vaccinated under phase 1A and 1B. So we're now looking at the balance of that age cohort, and we want to get them vaccinated as soon as possible. But what obviously holds back the program is the available Pfizer supply. But we've established the AIS arena to allow us to do 24,000 a week. That opens on Friday. If we get 24,000 Pfizer doses a week, we will get through that cohort quickly. But at the moment, I think we're still sitting at about 17,000 Pfizer doses a week arriving. But we are anticipating that number to increase in the coming months.
So in terms of a timeline, when are we thinking that those 16 to 29-year-olds are actually going to start getting some jabs in their arms?
Oh, as I said, late October, November. So if you are 18 to 29, you can get an AstraZeneca shot today from a pharmacist or GP following a discussion with them in relation to your health status. Under 18, 12 to 17-year-olds, Pfizer is currently the only approved vaccine available, and so you need to go through those processes, except that we have a special program for vulnerable 12 to 15-year-olds to access Pfizer. But it is still some months away before the 16 to 29 cohort will actually get jabs in arms. And so that's why, again, the Prime Minister's announcement wasn't particularly helpful, because it just created confusion.
If we're looking at late October, early November for 16 and 29-year-olds to have their appointments, how's that going to meet up with, National Cabinet's goal to kind of vaccinate as many 12 and 15-year-olds as possible before the end of the year? Because that's not really leaving much time.
No, I know, it's really difficult. It makes Moderna crucial and its arrival, and then any extra Pfizer that the Commonwealth can access through some sort of international transaction like they did with the 1 million doses out of Poland. That's the fact. That's the whole difficult issue that we are dealing with at the moment, is trying to vaccinate as many people as soon as possible is contingent on how many people take an AstraZeneca dose, that we do have a lot of, and then the available Pfizer supply, and then when Moderna comes into the mix. Now, the hope is that the months of October and November will be the biggest months of vaccination, both in the ACT and nationally, in order for us to get to a point, and I think the nation is currently tracking towards 80% double dose in late November. It would be everyone's desire to have way more than 80% double dose vaccinated by Christmas, and I hope the ACT can be at 90 to 95% by Christmas.
On those targets looking for 90, 95%, does the government have projections for how many people won't get vaccinated for whatever reason?
Well, look, the best indicator of people who won't get vaccinated are the proportion who haven't had a first dose. Very highly likely that if you turn up for your first dose, you're going to come back for your second. And across the age cohorts, we've consistently been able to get over 95%. We've definitely done that with over 70s. It's looking very strong for over 50s. My generation, Generation X, looking pretty good as well. I reported yesterday that between vaccinations already given and bookings, we look like 90% now of 30 to 39-year-olds either vaccinated or booked for a vaccination. So the clincher here is going to be what 12 to 29-year-olds do. That'll seal the deal of getting us to 95%.
Families and women in the ACT are currently unable to access IVF treatment. Is IVF considered non-essential during the lockdown, or should private clinics be offering the treatment to families?
I might get the Minister for Health to address those issues in a moment. Are there any other questions for me? No? Questions for the Chief Health Officer? Okay.
I have another question for you.
Yes, okay, yes.
At National Cabinet on Friday, the Prime Minister talked about the fact that a lot of hospitals are needing to be bolstered, that there are concerns that health workers who are in isolation in some areas, there might need to be, the movement of health workers in different states. What are the ACT's primary concerns once we do start opening up, we do start seeing more cases?
Sure.
And how are you bolstering the health system for that?
I'll get the Minister for Health to deal with part of it, but I'll deal with part of it as well. So the way we've, as a nation, been able to quite effectively manage localised outbreaks in particular jurisdictions is, and this is the situation in Australia now, where you've got outbreaks in 3 states and territories, us, New South Wales and Victoria, and pretty well COVID zero in the other parts of Australia. That has meant that those other parts of Australia have been able to help the states and territories that have cases. So for the ACT, that has meant that both Western Australia and Tasmania have assisted us in things like contact tracing. So that has been really, really useful. The issue we're going to face when the entire country opens up and COVID is everywhere, is that everyone will have to deal with their local situation, and it is unlikely that there will be the capacity for another part of the country to come to the rescue, because they'll have their local COVID issues to deal with. Now, that risk is greatest at 70%, because TTIQ will not be optimal, and there'll still be 30% of the adult population, let alone the under 16s unvaccinated. I think 70%, that threshold is really only about 56% of the nation vaccinated. So that's why there's a massive risk at 70%. And no, states and territories won't be able to come to the rescue of each other. So our planning and our provision for this goes to an early, and it was criticised at the time, decision to build the surge centre adjacent to Canberra Hospital. But gee, that's proven its worth now over the last 18 months. And we are in the business, as we have been through the pandemic, of employing more health professionals to assist with the running of our health system, and really in preparation for what's going to be a difficult period. It doesn't matter which set of modelling you look at, once the nation opens up, there's going to be cases. There's going to be hospitalisations, and there's going to be people in intensive care in numbers that Australians might find very uncomfortable, perhaps with the exception of New South Wales, because we're seeing that play out right now. All of which brings us back to a fundamental point. More people need to be vaccinated more quickly. Thank you, and I'll hand over to Dr. Coleman for questions, and then Minister Stephen Smith. we'll take questions. Thank you very much.
Are you able to just provide an update on how many chains of transmission, or I guess entry points, you're investigating in regards to the virus? So we know obviously that the fiction was the first case that you started investigating and different chains of transmission there. How many are you looking at the moment?
So this is something that changes on a daily basis. At this point in time, we have approximately 20 cases for which we can't actually identify the source of the infection for those cases. Some of those cases are truly just cases that have appeared that we're not sure of any links. Some of those are well associated with these new clusters, but we don't know what the source of introduction into those clusters were. But I guess as that doesn't mean that we're investigating 20 different introductions into the ACT from New South Wales. I guess we're potentially looking at more than one introduction, but it's actually really hard to unravel and unpick all of that. Sometimes those cases will just peter out and burn out, and we won't actually see any onward flow from those unlinked cases. So it's actually really hard to give you an indication about how many of those are going to result in unknown or ongoing chains of transmission. That's part of the reason why we're just asking everybody who has any symptoms at all that might be associated with COVID, or if they are known to be linked to those exposure sites, to get the testing, because that's how we can get more information to unravel those mysteries.
And you did mention that there were 2 new cases linked to the fiction cluster. Could you just clarify, are those from onward transmission, or are those new cases that have kind of emerged through exit tests, quarantine exit tests?
Let me just confirm for you. So 2 of the cases, I believe, that came in the last 24 hours are 2 new cases, so may well have been exit test or may have been new people coming forward. I don't have that detail. But 4 of the cases that we've previously announced now have linkages to that site.
What can you tell us about those new cases in ICU at the moment? Were they already in hospital and their condition has deteriorated, or are they people who've come freshly to hospital and gone straight into intensive care, and what can you tell us about them?
So it's really difficult, as we've discussed before, to discuss individual cases and the details around the cases. What I am committing to you today is to actually look at the cases that we have in hospital, and we are looking at whether we can identify some specific risk factors to talk a little bit more around what our cohort or what our group of patients are that look in hospital, and does that tell us anything about vulnerabilities. We do have our COVID Care at Home program, of which the cases are known out in the community. So that is our mechanism for trying to ensure continuity of care across the board. But if you bear with me until tomorrow or the next day, we'll have a little bit more information on what our hospital patients look like.
You said previously there was one child under 12 who was in hospital. Is there, can you give us any more about the age ranges of patients? Is there any more children of that age?
So from what I know at this point in time, they're all adults.
Clarify, Dr. Coleman, if there were any further positive cases from Condamine Court or this new exposure site at Ainslie Village?
So as part of the tests or the cases that we're reporting on today that were up until the 8 p.m. last night, not that I'm aware of, noting that there is still some investigations undergoing. But you are aware that we went to the site, particularly Ainslie House or Ainslie Village yesterday, and offered testing to all of our residents out there. And we do know that 2 of those results have come back positive this morning. I don't actually have any more information at the moment. The guys are on site, and we're actually going through that process of identifying who that is, having those conversations and working through what else we need to do. But I guess I would just add to that as we've talked about before, we have a really strong multi-agency program that we have. It's very close to our current site, and we are very keen to make this as person-centric as possible so that we can provide as much support to people. And we'll have more information to talk to you about that tomorrow.
I suppose, is it concerning that another social housing complex has arisen as an exposure site?
Yeah, and I think as the Chief has talked about, we've always known that there are really vulnerable settings. Public housing high density settings is always a vulnerable site. We've also known about residential aged care. So we've done extensive planning in these places. This is a concern, but we have plans. We have lots of people on site. We have lots of engagement, and we just continue to need to work with the communities and support them as much as we can.
Just wondering if you could provide a couple more details about how ACT Health is bolstering the hospital system, the health system, once we start opening up.
So I'll talk a little bit about the public health side, and then I might pass over to Minister to talk a little bit more about the health system side. So what you will have noticed is over the last 2 to 3 weeks, we've had a massive increase in cases and contacts that have been incredibly out there. So we have put all our surge planning into place, but noting that many of the places that we've taken surge from have been across whole of ACT government. We've had assistance from Commonwealth government, but also many other or private organisations around the ACT. So our work now is to look at what our plan is for public health in terms of being able to scale up and down as we need to when we know that we will open and that we will flux with cases moving forward. So we've had a great introduction, we've done a lot of planning, and we just need to continue to do that. But I will hand over to Minister if there's nothing else for me to answer the second half.
Could I just clarify the vaccination status of the new hospitalisations today?
So overall, I know that, did I say there was 10 or 12 today? 12 people. We know that 11 are unvaccinated and 1 person has received 1 dose. Thank you.
Hi, sorry, question?
Yes, sorry. So just 2 questions. The first is, what is the ACT government and ACT Health doing to bolster the health system for when the territory and when the nation starts to open up again?
That's something that we've been discussing across all state and territory health ministers and, of course, with the Commonwealth Minister, Minister Hunt as well, as part of our regular conversations. We all know that there is pressure on the health system already right across the country. We've seen that. And I think it's really important to recognise that some of those other pressures we've seen as a result of the pandemic around things like mental health will also come into play as we look at bolstering the health system resources. Specifically in relation to supporting COVID-19 patients, Canberra Hospital obviously has its COVID-19 ward set up, and Calvary Public Hospital is also setting up a respiratory assessment unit to support those COVID patients. The Chief Minister talked about the Kerryn Surge Centre and the capacity to use that for its original intended purpose as a specific emergency department for people who either have or are suspected that they may have COVID-19. And so that is still available for that purpose should it be required. That's probably not its likely next use, but that will still be there. And of course, all of that contingency planning was done last year around expanding ICU capacity, expanding dedicated ward capacity, should that be required. But this really comes down to the importance of that high level of vaccination across the community before we start really opening up. The international evidence is indicating that with that very high level of vaccination, you are much less likely to see a really significant impact on the health system. And that is why it is so important that everyone who has the opportunity to get vaccinated takes that opportunity and gets vaccinated. If we get to that well above 80% rate of vaccination across the community, we are far less likely to have as many people presenting to hospital and needing intensive care treatment. That's what the vaccines are designed to do, is to reduce the impact of COVID-19, the severe impact of COVID-19 and the need for people to be hospitalised. So it's absolutely critical, and that is why the Chief Minister has been so consistent around focusing on the reality of the national plan and the ACT's efforts to ensure that our vaccination rates continue to be above the national level, and that when everyone else gets to 80%, we will be well ahead of that. And thank you to the ACT community for your willingness to get vaccinated, because we do have incredibly high levels. We have around, according to the data, a 99% vaccination rate for first doses among people over 70 years of age. So that is absolutely fantastic, but we obviously still have a way to go with those younger age groups.
Just on IVF, families aren't able to access that treatment at the moment. Is IVF considered non-essential during the lockdown, or should private clinics still be offering the treatment?
So that was changed as of midnight on Friday. So the tweaks that came into the lockdown arrangements from midnight last Friday actually expanded access to IVF. So the very hard lockdown, access to IVF was limited to those people who were in a current cycle of IVF or who needed fertility preservation treatment fertility preservation because they were about to undergo another treatment, for example, for cancer that may threaten their fertility and wanted to preserve that. But as of midnight on Friday, IVF is available again. Sorry, this side?
Just on the quarantine release delays, has that backlog cleared? And are you able to just provide any information on how many people were, their release was delayed?
Yeah, look, we are still working through those numbers to really understand exactly what happened over the weekend. What I can say is that a decision was made yesterday afternoon to advise all of those people from Gold Creek School, Harrison School and Lynham High School that they were released from quarantine. So we know that there were some people in those groups who still hadn't received their release from quarantine. There were a range of technical issues that were resulting in that outcome, and I recognise that it was very frustrating for people, and for some people caused quite a lot of distress. And so again, I apologise to all of those people. This morning, those who were from the St Thomas Aquinas, Lake Ginninderra College and Chapman After School Care program groups have also been directly advised that they have all been released from quarantine. It is a very Canberra thing, I think, that people would stay in quarantine up to day 16 or 17 awaiting that advice from ACT Health. It does speak to that very high level of compliance that we generally see across our community. And again, I thank those people. As I said, I don't have specific numbers, but what that has also enabled us to do is to then focus efforts on anyone who is not in those groups, so someone who returned from a COVID-affected area in New South Wales, for example, who has not been able to leave quarantine on their day after day 14, to make sure that we get through those. And the advice we had this morning was that there were fewer than 200 callbacks still to be made on that line from yesterday. So I'm really hoping that by the end of today we will have got through all of that. And again, thank all of those people for doing the right thing and staying in quarantine to protect the community, and apologise to anyone who did experience this. I also know that lots of people did receive their release from quarantine as well, but for those who didn't in a timely way, we do apologise and we thank you very much for your patience.
The ACT is a hub for the region for vaccinations. Have we seen people from border communities cancelling their appointments, not wanting to come to the ACT or not thinking they can come? And can you say how many of those appointments have been cancelled from border communities? So what
the ACT health authorities have been doing is working very closely with Southern New South Wales Health District, and where relevant with Murrumbidgee Health District, to ensure that the appointments for people outside of our local postcode areas where people have that standing exemption, for other people beyond that, that their second dose appointments can be transferred into their appointments can be transferred into their local region, and providing the doses to do that. So again, the last number I heard around that from memory was around 800 people that were affected by that, and the health authorities, our ACT Health, working very closely with Southern particularly to ensure that those transfers could be made.
We've heard reports of people showing up for their second dose appointment from these communities and being escorted out by ACT police. Has there been a failure of communication on this?
So I'd like to get some further information from you on that. We are advised by ACT Policing that they have not been escorting people out or turning people away from the border if they say that they have a health appointment, that they are in fact exercising discretion in relation to that, and when people say that they have a health appointment, allowing them to continue to that. So if there are specific examples, of course we would be happy to follow those up, but we're not aware of policing turning people away in relation to those appointments. What they may be, however, if you are from outside the region, outside that local region, you do need an exemption to enter the ACT. So simply having an appointment is not actually sufficient to enter the ACT. So if anyone is watching from that wider region, you do actually need an exemption to enter the ACT, and police will be checking that. But my understanding is they are also using discretion if people turn up without an exemption and say that they have a health appointment.
Just on the vaccine rollout for 16 to 29-year-olds and that August 30 date, the PM's announced not quite matching up with what's possible through my DHR at the moment. How are you anticipating that will play out over the coming days? Is it going to be, a staggered rollout of invitations, or will it be a first come, first served sort of process?
Well, I would reiterate the Chief Minister's point that we encourage 16 to 29-year-olds to register through My DHR so that when we have that vaccine supply available and we have those appointments available, we can immediately let people know about that. And we intend to do that in the same way that we did for those 30 to 39-year-olds who had pre-registered, where we said, OK, appointments are open. Everyone who had pre-registered got a text message. Yes, it took a little bit of time to get onto the system because everyone can't book the same appointment at the same time. So there needs to be a bit of a process in the system to do that. But we have already opened registrations for those people. We cannot give them appointments that do not exist. And that, I think, is the difference in terms of our approach versus the Prime Minister's announcement. We have opened registrations. There may be that there are some GPs now in the ACT who have appointments that are available that people in that age group may be able to access. My understanding of that Commonwealth eligibility expansion is that it also includes 30 to 39-year-olds who, of course, have been able to get appointments through ACT government vaccination clinics for some time. I will be talking to the team about just working with the Commonwealth to ensure that their eligibility checker is very clear about where you can make appointments in the ACT. This morning when I looked at the eligibility checker, it still had Kerryn on there rather than AIS. Obviously we want them to update that. But it also still had the description of Kerryn as being only available for appointments for people in phases 1A, 1B and 40 plus, which is obviously very out of date. So we'll be talking to the Commonwealth about updating their eligibility checker information right for both of our sites at the airport and now at AIS. But we also are encouraging 16 to 29-year-olds to register on My DHR so that as soon as appointments are available, they will be able to book in.
Further on our cross-border communities, the ACT also a hub for maternity services. There's a lot of anxiety for people in those communities who are pregnant and they need to come to the ACT for appointments or to give birth. Is there measures in place for those people at the moment? Do they differ from the measures for those people in the ACT?
Yeah, so CHS has assured me and assured, I think, the community through the online article on ABC that no one is being denied entry by Canberra Health Services. But as part of the response to COVID-19, where appointments can be shifted to telehealth, they are trying to work with consumers, with patients, to shift those appointments to telehealth where they can be. If they can't be, of course, patients can come to the ACT to get the right care in the right place at the right time. We do understand that this is an extraordinarily difficult time for patients in our region. We would certainly encourage people to talk directly with their health provider at Canberra Health Services or anywhere else in the ACT to apply for those exemptions, and exemptions are being granted for those health services that are required here in the ACT. So if there has been confusion around that, I of course apologise to anyone who has been affected by any confusion in relation to that, but I'm assured by CHS and I want to assure the community that CHS is absolutely not denying entry to its services for people from our region who would normally access service in the ACT.
Childbirth, for instance, something that doesn't want to be done over telehealth, obviously. Is there different arrangements at the hospital then for women who've come from outside of the ACT? Is there different rules in place for who they can have with them, etc.?
Not as far as I'm aware. Once you've received the exemption, of course, it would depend on, if your specific LGA was identified as high risk, or if there was some other reason that there might be a particular risk associated with someone from that area, then there may be additional precautions put in place. But my understanding is once you are coming to the ACT and you've been granted that exemption, that the same rules would apply. But we can clarify and follow up and get some more information back to you on those specific rules around birthing.
And clarify on that there are rules that are different to how childbirth would normally take place in the hospital. At the moment, there is some restrictions on who you can have on site, for instance.
Yes, so there are visitor restrictions that are in place across the hospital and apply to ACT residents. So there is a restriction around the number of people who can be accompanying a person giving birth. That's only one visitor, or one support person is my understanding, and that support person can stay with that individual as long as they don't leave the hospital. If they leave the hospital, they're not able to return. Okay, great, thank you.